Yes, doctor, is very much clear.
Thank you to the MC for one introduction and a brief introduction of me. So yeah, I will take the lead from now on. Uh, for the next session, allow me to introduce our esteemed speaker for tonight's session. Dr. Babaktini Olatunji Laleye, Doctor of Veterinary Medicine, Master of Science in Education. He is right now is a hospital practitioner at the Vet Agro Subcell Laboratory in Lyon, France. He is a highly respected expert in veterinary medicine and has extensive experience in biomedical research. His educational background are State Certificate of Veterinary Doctor of the Interstate School of Veterinary Sciences and Medicine EISMV of Dakar, Senegal, January 2007. National Diploma Internship in Private Hospital of Equide at the Paul Equine Vet Agrosub Veterinary Campus of Lyon, France, and in July 2010. And Master of Science in Education for Research in Education, Université Lumière, Lyon 2, France, at June 2024. And the last is PhD student at Université Lumière, Lyon 2 in Educational Sciences on affordance and simulation-based learning in veterinary education at the EPIC 485 Doctoral School 2024 until now. So he has a lot for the next, I think. Yeah, he has a lot of working experience, but right now he is a hospital practitioner at the Cell Laboratory in Lyon, France. So maybe next. So he has a lot of achievement in academic activities. There are 8 publications, 10 posters, 5 oral communication activities, and 4 participation in international congress. His passion for advancing veterinary practices and his significant contribution to the field make him the perfect speaker to discuss animal models in veterinary and biomedical research. Dr. Lai. Hello.
Hi.
Doctor. Oh, hi.
Yes.
Yeah. Okay. How are you, doctor?
Fine. Thank you very much.
Yeah,
Hi to every one of you.
Yeah, I'm glad to hear that you are okay and you are fine right now. So yeah. Can I call you Dr. Francois from this point on? Because I already talked to you, like I call you Dr. Francois, then Dr. Laleye. Is that okay?
Yes, it's okay. Thank you.
Call you Francois. Okay. So yeah. Yes. Thank you. Before we begin, I would like to announce the rules for your presentation. I mean, the rules for your time. The presentation session will last for 45 minutes. As the moderator, I will remind you when the time is almost over or if it has exceeded the allocated time. So are you ready, Dr. Francois?
Yes, I am ready.
Okay, so yeah, Dr. Francois, the stage is now yours for the presentation. Thank you.
Thank you very much. Hi, every one of you. Can you see my screen?
Yeah, I can see your screen really well.
Okay, perfect. So first, I want to thank all of the committee for my invitation, but also for the organization of this meeting. I am very happy to be here. As you say, my name is Babagdine Olatunji François Xavier Laleye, and I had done a lot of equine clinic on the fields. But I have one question, and I want to solve this question. How can we train better? This is my interrogation, and it's why I decided to come back in school and to do a master and a PhD in the education science. So today, we will speak about the Devinekoi example of simulation as a means of enhancing learning in veterinary education. So on my way of simulation, I am very happy to have a mentor. It's named Professor Sarah Bailey, and she helped me a lot to have a better understanding of what is simulation in veterinary education. This presentation is divided in 2 parts. The first one will be an introduction to simulation. We will see together some definition, and one classification of simulation. And after that, I will share with you Devinekoi, a game to learn better. So you will see that it's possible to learn by playing in veterinary education. So actually, what do we see in veterinary education? We see that there is an increase in the number of students. Everywhere around the world, there is a lot of young people who want to become veterinarian. That is very interesting for our profession. In another hand, people have a growing interest in animal welfare. They don't want to see their animals suffering. This is also very interesting, but it makes it difficult to work on live animals. Also, the quality still required. All of these owners, they want veterinarians to save their animals, which is not every time possible. So that puts a lot of pressure on veterinarians. One of the biggest questions is how to improve veterinary education without touching live animals. The solution seems by integrating simulation into training. But what is simulation in veterinary education? Is it a magic potion? Something you will give to your student and suddenly they will be able to do everything everywhere with perfection? Or is it a buzz? Something that after a few years, no one will even remember what is simulation? As you mind, simulation is more than that. If you look at the definition of simulation, it says that simulation is the imitation of a situation or process. In the context of veterinary or medical education, a simulator is a device or set of conditions that aims to initiate real patients, anatomic region, or clinical task. If you want to summarize all of this, you can just say that simulation is like a toolbox. And in this toolbox, you have a lot of tools. Up to you to know which one you need for which situation. Also, with the simulation, we are able to reduce the number of animals we need to train veterinarians. Sometimes we are able to replace animals by model. And this will help us to refine the process we put to take in charge animals. So this is the rule of the 3R by William Russell and Rex Birch. This last year, we introduced a new one. It's respect. We must show respect to animals when you have manipulation on them, but also show respect to their help to the training of veterinarians since all of these last years. If you're still wondering why clinical skill training is so important timely, just have a look on the European Association of Establishment for Veterinary Education. In June 2023, they edit one operating procedure, and it's all about this concept, never the first time on a live animal. I am sure you already hear about it, but this is not from the veterinarian education. It's from the human medicine education, and it's never the first time on a patient. And we want to introduce this in the veterinary education. What does it mean? It means that you get the knowledge in your regular classroom. You go on tutorials, by example, with dissection in anatomy. After that, you are able to train on models. And finally, you will perform an IVEC catheterization on a real dog. This is what it means, never the first time on a live animal. That means that when you touch the animal, you have all of this knowledge and competencies, and you can perform successfully your skill. Also, the American Association of Veterinary Medical College edit one handbook on the use of animal in veterinary education. There is also some guidelines. All of these resources are free access. So please, when you will get this presentation, take the time to have a look and you will have a better understanding of how and why we want to use simulation in veterinary education. When we speak about simulation, there is a lot of classification. I choose the one of Guillaume Alignus with 6 levels. The level 0 is used during exercise or tutorial. By example, if you want to learn how to make suture in surgery. It's a very basic model. We just take 2 gauze pads, we tape them on a piece of wood, and student can train to make suture. So this is the level 0 of simulation. The level 1 is about the low fidelity model. It's used to building knowledge. You can use simple models and you will be able to do 1 task or 2 maximum. By example, you have this model, it's a CPR mannequins. This is a piece of silicone. It's used in human education and students can take some blood sample on this. If you want to have the same in veterinary education, this is supposed to be the leg of a dog with PVC tube, and on this model, a student can learn how to perform an IV catheterization. This is also a model of level 1 to learn how to make suture, but here we use silicone. It seems like a skin. The level 2 of simulation is all about the digital. You have virtual reality and a lot of support in computer. This is the level 2 of simulation. Level 3 is about role-playing and standardized patients. You can do it in specific room or with professional actors, like here, or you can do it in classic room. This was in Senegal. We do not have the money to pay professional actors, so we work with people from the university staff, and these people were very happy to get interaction with the student. Also, the student enjoys his time and they learn a lot. So usually the level 3 is used to teach skills like soft skill or communication. Level 4 is the might fidelity model. Models are more realistic and you get the ability to perform several different actions on the same model. Maybe you already see this model of cow. It's a very expensive one. It looks like a real cow, same size, and on this model you can reduce dystocia because there is a calf, you can put it in a lot of position. You can perform rectal palpation, milking, even handling. You can teach how to handle correctly a cow to your student. So this is the level 4. The last level from the classification of Guillaume Aligne is a high fidelity model. We do not have this kind of model in veterinary education because if you look this mannequin, it's like a real patient and he is able to speak, he is able to have convulsion, heart attack. So usually this mannequin can be connected to a control room where an instructor can speak by the mannequin and can make it having convulsion and so and so. So that means that during the consultation, the student will have to adapt their reaction to the action of the model. In veterinary education, we get a model of a dog. Of course, we can make some programmation of his heart rate and respiratory rates, but it will not change during the manipulation of the student. We can say, if we want to summarize all of this classification, that in most of the veterinary simulation labs, we have a lot of model on level 1, level 2, and few model from level 0, 3, and 4. But just keep in mind that if you increase the fidelity of the model, the cost will increase and the maintenance will increase too. Now I want to give you 3 cases for unlocking the simulation box. With these three cases, you will be able to use as the best manner as possible the simulation in your studying. The first one, simulation is not about pretending, it's about simulating. Get used to what you are doing. And the last one, learn the right method, then practice it. So, what does this mean? Simulation is not about pretending, it's about simulating. These words are from Guillaume Oliver. He is a professional photographer, and during 4 weeks, he was in a big simulation human center. And after that, he had these words with the staff. It means that whatever the level of fidelity, a model remains a model. It never ever becomes a live animal. But on a model, you can learn in peace and master the technical skill. That's very important. So next, you will bring the model to life with your imagination. By example, you want to learn how to perform an IV catheterization in the dog. You turn on the model. When you know how to do it, so you say, okay, I know this is a PVC tube, but if it was the hand of a dog, I must be more gentle. I must pay attention to my position and so and so. And the day you will have a live animal, you will be able to perform easily. Also, keep in mind that pilots and soldiers do a lot of simulation. Every time they must be in simulation center. They know it's not true, but they know that with simulation, they will be the best on the real life. So as a veterinarian, if we think and act like a pilot, we will use simulation in the best way as possible. The second key is get used to what you are doing. Usually, when you want to learn a new clinical skill, it can help you if you make some checklist. That means if you break your action down into steps, step 1, 2, 3, and you will see that it will be more easy for you to learn all of the process and to perform easily. It's the same for the pilot. Before landing and before takeoff, they must have their checklist. So that's very helpful when you want to learn a new clinical skill. The last key, learn the right method, then practice it. Practice makes perfect. If you want to be the best, you have to train, train, and train. And I am sure that with this kind of case, as student, if you use it when you are using simulation, you will be very good at least. This ends our first part. Let's speak now about Devinekoi, a game to learn better. So, what are the qualities of a good clinician? Usually, a good clinician must be able to see with fingers. You must be able to judge distances, shapes, texture, and also to describe what you are touching, to communicate with your colleague and the owner so they can understand what you want them to see. One example, in Senegal one day, a sheep's owner comes to me with his sheep. His sheep was lame because his hind leg was painful. I do not have X-ray, no ultrasound, only my fingers. And when I make the palpation of the leg, I can feel something. It was not bones, it was not muscle. And finally, I put outside this leg, this spine. You can see that it's very long. So it's why it's very important that you are able to see with your fingers. But how do you train the vet to use sense of touch and communication skill? As inexpensive as possible and in a fun way. Inexpensive as possible was very important for me because in my veterinary school, we do not used to have a lot of money. Not much veterinary school have a lot of money. Money is always one of the biggest challenge you have to success if you want to have innovation in your way of learning. It's why we find this solution. It's a game named Devinekoi. If you look at the classification of simulation from Guillaume Aligne, Devinekoi should be between the level 0 and level 1. And you will see that Devinekoi is an integral part of a new approach, learning by playing. We want students have fun when they are learning. But why do you want students have fun during their study? It's very interesting. If you have a look in the world of veterinary medicine, you will see that there is a high incidence of mental illness. There is a high dropout rates. I know a lot of veterinarians, just after their graduation, they say, okay, I do not want to be a veterinarian anymore. I want to sell pizza. I want to make business. I want to open a haircut shop, and so and so. And that is very painful because we all know that veterinary studies are very difficult. After all of this sacrifice, you decide to stop. The last but not the least, we have a high suicide rate compared to other professions. This is the situation all around the world in veterinary profession. But if you have a look on this tree, you will see that all of his roots are in the world of study. Because in the veterinary education, there is a lot of stress, and the stress will increase and growing years after years. It's also during the world of study that students adopt a bad way of living. And all of this will follow them in the professional world. It's why it's important to keep in mind that the student you are today will be the veterinarian tomorrow. You will not change. So please pay attention to your mental health. You can have some activity like sport, meditation, and learning with game. All of these activity protect against stress. It's why every time as possible, we use game to teach wherever and whenever we can. And there is a lot of game in simulation. I will just give you two examples before speaking on Devinekoi. These examples are from the North Carolina Veterinary College. It's very simple. You just take a wire and you must put some pulse on it. It's very difficult to catch the pulse because you have different level and different size of pulse. You can do it with two students and it will develop your precision, dexterity, and vision. So it's very interesting. Another one, it's with Lego pieces. You put the Lego pieces in this box, you put the plan on the top of the box, so you cannot see the pieces, and you must be able to reconstruct the model as quick as possible. You develop your sense of touch, coordination, design, and organization. But you can also play it with two students. One will get the plan. He will look at the box so he can see the pieces, and he will guide his colleague, and together they will build the model. It means that they will have a lot of communication and explication, always in a funny way. So let's speak now about Devinekoi. Of course, Devinekoi is a game, but it's a game for learning and teaching. That means that we must have educational objectives. Concerning Devinekoi, we want to develop the psychofacial representation, the psychomotor reflexes, the communication skills, and the sense of touch. These are our educational objectives. And you don't have to pay money. So how do we play Devinekoi? Concerning the equipment, you will need a mask. It can be a sleep mask, as you get in the plane. It can also be a dental mask. It's up to you. You will need a stopwatch, but you can use your phone, some set of objects, and a table with an opaque partition in the middle. Concerning the participants, you have one player, player A, player B, and you have one student who is the timekeeper. Also, you need a teacher or a coach. First, the supervisor will blind player A. So this is player A, she cannot see, and I give her one object, X. After that, I give to player B 3 objects. In the 3 objects, there is object X and 2 decoys. Now the timekeeper will start the stopwatch, and player A must be able to make a good description of his object so player B can recognize it between the decoys. When player B thinks he gets a good object, the timekeeper will stop the watch and player B will show the object to player A and the decoy too. So this is how we play Devinekoi. But how do we organize Devinekoi? It's also very simple. If you just respect these key points, the first one, only player A speaks for the description. Player B do not ask any question. But if player B need more information, he can say, tell me more, please. Tell me more, please. But he do not have the right to ask question like, is it like this? No, no question. If you don't have an opaque separation, you just put the player back to back, and you will see that it's very easy when you use this position. This is player A. He cannot see. He get one object in his hand, and this is player B. You have the timekeeper. So it's possible to adapt to your environment. Other important key points, it's about the object set. The color is not important because player A is blind, so he cannot see the color, only the size, the shape. Make sure you have matching pairs. You can use chirurgical materials. Legos, bones is definitively up to you. And I will make you the presentation of the 3 sets we use to use in this game. The first level is the beginner level. We do it with the set Salsa. Level 2 it's set Tama, and the last level advanced it's with the set Tiki. So concerning the set for the beginner, it's very simple. The number of differences is up to 4. We need a lot of differences. So the student blind can easily and quickly make a good description. It's because we want students to understand the game and be confident. It's only the first level. This is example. Here it's a set of bottle caps. Their height, depth, size, top, all are different. So if I give this one to player A and he make a good description, quickly player B will be able to make a good selection. We use a lot of screws. This is object X. I give it to player A. He cannot see. And if he make a good description, if he speak about the head, you can see that it's not the same head. He can speak about the material. These two are in steel, but this one is plastic. The length and also the size. So you have 4 differences. It means that the selection by player B will be easily. Level 2, it's a Tama. Form still simple, and we have small differences, 2 or 3 only. But we also can have something quite different. By example, look at this case. If I give the yellow one to player A, and I give all of these 4 cases to player B, if player A speak about the head of the case, player B will easily choose the good one. So there is only one big differences. We can use Lego pieces. So here the length is not the same, 1, 2, 3, 4. Here only 2, only 2, only 2. If you look at the side, you have hole here. Here you have some line, and here nothing. So this is also a set for the level intermediate. You can use markers. Here is your object X. This is the other object X, and you have 3 decoys. There is difference on the top, the size, and the bottom. So set Tama, always 2 or 3 differences. The last set is sticky. Here, the number of differences is less than 2. And there is very small differences, almost similar objects. Example, you can use screws. All of these screws, they have the same head. All of them are in steel. Concerning the length, it can help you, but you will just remove these 3 screws. The challenge will be to make the difference between object X and the decoys. Same head, same length, same material. The only difference is about the size. So you know, this is the type of set we use at the advanced level. Another example, I know you know all of this. It's catheter plug. This is a catheter. So there is a lot of type of catheter plug. Look at their top. All of them, they have a hole on the top. If you look at carefully the sides, all of them, they have some line. So it's very difficult to make a good description and to help player B to select the good object. How is a classical Devinekoi lesson conducted? We used to play it in 6 rounds. 2 games with set salsa, 2 games with set tama, and 2 games with set tiki. Each player is blind in turn. That means that if it's your first set, this is player B. He gets some very small pieces in his hand, and this is player A. After this set, player B will become blind, and he will have to make description, and player A will have to make the selection. And this is 1 round. After that, we use another set like Tama, and we change each time. So each player is blind by turn. Concerning the level of difficulty, you can increase or decrease the level of difficulty. It's up to you. If you want to decrease the difficulty level, you can give the right to speak to player B. So player B may have 1 question for 1 set. You can also use the self-correction. Self-correction means that when player B thinks he gets a good object, he will give it back to player A. So player A is still blind, he gets object X and he gets the object from B, and he must say if it's the same object. This is very interesting because when you do this, you will see that the sensation you have with your left hand are not the same with your right hand. So sometimes player A gets 2 similar objects and he say no, it's not the same. So it's also show you the importance of our vision and how without seeing we can be in trouble. We used to give some tips to our students because don't forget that this is an activity to help them to build knowledge, and specifically we insist that they must be logical during their description, describing first the size, the shape, the texture, and side by side of the object. Also, it can help them if they know the size of their little finger or 1 phalange of their thumbs. Also, concerning player B, if you want quickly to select the good object, just put all of the objects on the table and try to find what makes them different. So when player A will make the description, it will make sense to you. We can say that Devinekoi is like a car body, a car frame. And on this car body, you can put a lot of type of cars. By example, if you want to train your student in anatomy, you will just add some set of bones. You know, you will use Lego pieces, and after that, now they know how to play the game. You will give them some small bones, and they will have to make the good selection. Also, you can use it in pathological anatomy. In this time, you will add some sets of wounds. You can produce some false wounds with silicone or 3D printing. It's possible. And also in bovine reproduction. So there is a lot of possibility of the use of Devinekoi. In conclusion, we can say that Devinekoi is an easy to use game that will bring joy and happiness to a class of learners of all ages. Usually when we play Devinekoi, students don't want to stop the game because they think it's very interesting. And of course, they learn a lot in their description and making sense between what they are touching. Thank you very much for your attention. I am very happy and I hope that this will be helpful. Please feel free to ask all the questions you have and we will try together to find solution and answer. Thank you very much.
Thank you very much, Dr. Francois, for your enlightening presentation. Now we will proceed with the Q&A session. I would like to announce the rules for this session first. The total time allocated for this session is 15 minutes. Participants are encouraged to ask questions directly to Dr. Francois, who will respond to each question immediately. And to ask question, you may use raise hand feature and I will call on you to ask your question live, or maybe you can type your question in the chat box and I will read it aloud on your behalf. Okay, is there any question? Okay, actually, Dr. Franco, actually I have a question for you because your presentation is really interesting for me because I'm also an educator for like you. I work in laboratory anatomy, like especially cross anatomy, right? Actually, I want to ask you about this. We in reality, we already have, let's say, we already have a curriculum or something to learn about anatomy itself by using cadaver. I mean, using a specimen, formalin preserved formalin preserved specimen, something like that, to learn about the anatomy itself, something like that. So, what are the most suitable animal models or alternative to replace formalin preserved specimen in veterinary training? Considering ethical and practical and educational factors, is there any suitable or the most suitable animal models that we can use for teach our student here, something like that?
Okay, thank you very much for your question. It's very interesting. Maybe the first level will be, what do you want to teach them? So if you have your pedagogical objectives, it will be easy to choose your model. By example, you have a lot of model of dog on computer. This is very interesting because it gives a possibility to students to go level by level. After the skin, they can remove the muscle, the skeleton, and so and so. They have a better view and a better understanding of anatomy. Also, it can be interesting to try to refresh their mind when they are already in clinic. You see? So because when they are in clinic, they need anatomy by practical anatomy. They want to know what's the name of this. And if you put kind of Devinekoi or kind of other type of model, they can learn it. You also have big model like level of fidelity 3 of horses. You have all of the organs in place, the lung, the heart, and so and so. And that is also possible. So first, which kind of skills you want to achieve, and at one time you will have the question of the money. How much do you have to pay the model? Because high fidelity level model are very expensive.
Okay, can I ask you some question related to my last question? It's about the,
Mm.
so that means if we try to change our specimen or our models for learning, I mean, how can we ensure the students to remain accustomed to real objects in learning? I mean, like in the end, we are the student, our student, we will be the vet, right? In I don't know what will they become. I mean, like we don't know that they will still do in practitioner or maybe the others or laboratory. We don't know, right? But how can we ensure that the students remain accustomed, sorry, to real objects in learning, such as animal tissue or organs, while using simulation model or other alternative? Is there any, you know, how can we can ensure if we change to the animal models like plastination, I think, or something like VR thing? How can we make sure the student will be, uh, that kind of thing?
Yes, I think I see what you want to say. Uh, what thing I learned by working with students is when we take the time to explain them carefully what we want to do, why and how, it makes sense to them. Because most of our veterinarian students, they want to be good veterinarian. But as you know, there is a lot of things they have to learn and there is a lot of activities they have to do. So if you explain them why it's important, because of course, when you been graduated, you can do what you want. But before, we all are veterinarian. So that means that we must all have the same basis. And this basis is that we know anatomy, we know physiology, even if after you want to make communication and so and so, you must be able to know that. And that is definitively very important. What we try to do also is involve student in the evaluation and the assessment. So they can have some assessment grid and they will work in small group. They will assess each of them, but there is a final evaluation made by the teacher. So also that can help them to take things with importance. Anyway, if they don't, the day they will go outside, the professional world is definitively so hard. So if you are not good, you just be scratched.
Yeah, I know that. I've been a practitioner too before I become a lecturer. So I know that how hard our vet
Yes,
life
but
outside.
students
Yeah.
don't love.
Yeah, yeah. Maybe Dr. Franco, my student have a question for you in the chat box.
Yes.
So I will read it. So it's from Nashwa. Uh, I ask question, hymns of salsa tama tiki may be suitable when you want to install a catheter on or an iron for an accidental operation. Are there other game-like models that can be used? How about the determined muscles? They are same as texture. Thank you. I mean, maybe, yeah.
So very interesting question. So concerning salsa, tama, and tiki, it's definitively useful when you want to perform palpation. Like you have a dog with a mass, you don't know which type of mass is it, and before deciding to make an X-ray or ultrasound, you must have an idea. So you will do a lot of palpation, also during surgery. But concerning the highway catheterization, the best type of model, it's a model in PVC. Why? Because what makes sense to you, it's how you can handle the IV catheter, which inclination and so and so. And when you know all of this, of course, the day you will be on the animals, it's not the same. It's alive, it's not a PVC. But you know how to do and you will adapt. It's why level model still model. But by model, you can learn a lot, and there is lot of type of model for learning how to perform IV catheterization. Concerning the muscle, you have some model which are definitively like a real leg of dog. You have skin, you have silicone to make the muscle, and you have small vessels. So it's also possible to increase the fidelity of the model for IV catheterization. I hope I give you answer to your question.
Okay, thank you for your brief explanation about the question. Is there any other question? I think we can, our time will be, you can answer for one question again, doctor. So yeah, is there any question?
So maybe I can say that the most important for students when they have to use simulation is to keep in mind that it's simulation, is not real, but it's safe. You do not have stress because in my time when I was a student, we do not have this. I have to learn how to make an IV catheterization on a real dog. And it's in an emergency. I do not have time. I don't want to, so a lot of stress. But now with model, you do not have much stress and you have the possibility to train, and perform. And the day you will go to the animal, you will be more confident. Confidence is very important in our work.
Okay. Yeah, Dr. Francois, I think I had one question on my private chat. I will read it for you. So yeah, what inspired you to focus on simulation as teaching tool in veterinary education?
A very good question.
Yeah.
I mean, as I say at the beginning, my biggest question is how can I be sure that what I am teaching to my students will be helpful to them? And I always try to find solution because I know that actually students do not have a lot of time. There is a lot of distraction because there is phone, social media, study is not every time interesting. It can be boring and you are tired to study because you are studied during long years before being a veterinarian. And it's why I always try to find how can I make my class more interesting for students? How can I reach their attention and keep it? And how can I make them involved? Because what we want as a teacher, we want you to be the best. This is what we want. It's why we work. Sometimes you don't understand. You think, yes, it's blah, blah, blah. But at the end, it's very helpful when you go on the professional work and you say, all right, my teacher was right. So this is my, how can I say this? This is my trap, my cat. This is what I want. I want to find an answer, but the answer is always moving to be
Yeah.
the best teacher as possible.
Yeah.
That's a challenge.
I know it's a challenge for me too, actually.
Yeah.
I think it's for
But
every teacher too. It's challenge for all.
yes, some of them don't think like that. But when you begin to think like that, for me, you are on the good way. Every time thinking, how can I do better? Even as a teacher, as a student, you have to think how you can be the best student as possible and be sure that it's only a small time. It's passed quickly. So be the best student you can and you will be the best professional.
Yeah. Wow, that's really great. Thank you, Dr. Francois. I think because our time is limited, yeah, maybe if there are any other question for all participants, please feel free to contact me and I will help you convey them to the Dr. Francois separately via email. I think, yeah, because the time is limited, so I will end this session here. Thank you once again, Dr. Francois, for your thoughtful and insightful responses. Before we proceed to the certificate awarding, let me provide a brief summary by Dr. Francois presentation. Dr. Francois presentation focused on the integration of simulation-based learning in veterinary education, particularly through the innovative Devinekoi game. The key highlights are simulation serves as a tool to replicate clinical scenarios without the need for live animals, aligning with the 3R principle, which is reduce, replace, and refine. It is an effective response to challenges in veterinary education, such as the growing number of students, animal welfare concerns, and the needs for high-quality skill development. 6 levels of simulation were introduced, ranging from basic models or low fidelity to advanced computerized system. The second one is importance of the clinical skills training is that simulation aligns with standards like EAEVE, never the first time on the live animals or on a live being policy, ensuring students master skills ethically and efficiently. It emphasizes the development of psychospatial representation, psychomotor reflexes, communication skills, and the sense of touch. The third is Devinekoi, is a simulation game designed to teach essential veterinary skills in a fun and stress-reducing way. The game involves participants working in pairs. One describes as a hidden object, while the others identifies it based on the description, developing communication and tactile skills. Devinekoi exemplifies the potential of learning by playing in veterinary education, providing students with hands-on experience while reducing stress and improving overall well-being. Dr. Franco approach emphasized that simulation is not merely about imitation, but a bridge to mastering real-life clinical scenarios. Okay, on behalf of the Faculty of Veterinary Medicine, Universitas Airlangga, I would like to present a token of our appreciation to our guest speaker, Dr. Francois, for sharing your knowledge and expertise with us today. So, committee, please show us the e-certificate for Dr. Francois. Once again, thank you, Dr. Francois, for become our speaker for today's event. Your experience, your material is really nice. It's really good for us to know.
Thank you very much. It was a big honor and a big pleasure.
Yeah, okay. Thank you once again, Dr. Franco, for joining us and inspiring us with your insights. So yeah, I will send this a certificate to your email after this. Okay.
Thank you.
Okay. Thank you. I now return. If you have any other activities, you can leave. Actually, it's okay. Or you just wait here until the session or this guest lecture ends. It's okay. It's up to you. So yeah. Okay. For now, thank you. I now return the floor to the MC to continue with the programs. Thank you.
Thank you.
All right. Thank you, Dr. Tantri, for moderating the whole event. Now it is time to award the certificate to our moderator, Dr. Tantri, for the invaluable role in guiding tonight's event. So this is the e-certificate, and we'll be taking picture with Dr. Tantri also as the moderator and with the e-certificate. Okay, so for the committee, please be ready because we'll be taking picture in 3, 2, 1. All right, thank you, Dr. Tantri, for guiding us through this event. So before we officially end this event, let us take a group photo together to commemorate this event. To all the participants, please ensure that your camera is turned on with your virtual background, and we will take several screenshots, so please